Grow is defined protein-rich
Grow
food.
is bodybuilding.
Yes, bodybuilding, which is known as
Glow.
protein-rich foods. Yes,
Glow হচ্ছে protect- protective food.
protective food, which is rich in vitamins and minerals. Okay.
Okay, ma'am.
Today we will discuss the growth pattern in adolescent. Can anyone explain which year is known as adolescent period?
After 20,
No. Anyone?
12 to 18.
Adolescence period,
12 to 18.
12 to 18. Uh, Actually, according to WHO, World Health Organization, adolescent can be defined 10 to 19 years. And the adolescent period is also classified in three categories. First is pre-adolescence period, which is known as puberty growth, after childhood completed, then adolescent, middle adolescent period, and late adolescent period. Pre-adolescent periods is in between 10 to 12 years, uh, and 13 to 14, 15 years is middle adolescent period. After 15 to 19 and 20 is known as late adolescent period. This adolescent period is play a very important role in our lifespan. What changes occurring this period? Can anyone explain? What will be the changes? Which type of changes? Physical changes occurs, and also mental changes, and also social changes, behavior, attitude. These are also plays a important role during this period. Due to our physical body changes in the adolescent period occurs due to the hormonal effects, and this growth rate and changes also different growth pattern of boys and girls. So in this period, dietary habit is most important. We during this period for growth and development. And most often adolescent girls often try to follow their friends or peer groups dietary habits or eating habits. So they skip sometimes the main meals, which are breakfast, lunch, and dinner. Most adolescents are skip these meals because of why? Because they eat snacks and fast foods in between this meal pattern time. So they face so many problems, so many changes in their lifespan. But sometimes in many research nowadays, recent in India, some adolescent boys and girls aware about their body size or physical appearance, which is known as physical appearance. So many girls and boys also skip their meals. They said that I am in dieting because they want to look slim. So they are starting their dieting, but they do not know it is the serious consequences on their health, because these practices may be bad for their health. because they may be undernourished and even seriously they do not eat proper nourishing diet, they may face anemic and also malnutrition. And boys, those who are uh, including in sports and so many activities, if they skip their meals, it also bad effect in their health. So during this period, dietary habit or good eating habit plays a important role in that in this period. So this adolescent, both boys and girls, should have three regular meals based on varieties of food groups. It means they are including in their diet is basic food groups. Food groups. These food groups are guide them to select their foods. ବହୁତ ସାରା ପିଲାମାନେ ଯୋଉ ଥାଆନ୍ତି ସେମାନେ କଣ ହୁଅନ୍ତି ଆଡୋଲେସେଣ୍ଟ ଟାଇମରେ ବହୁତ ବାହାରେ ସେମାନେ ଖାଇବାର ଇଟିଂ ହ୍ୟାବିଟ୍ସ ଅଲ୍ ଆର୍ ଇନ୍ ଇଂଲିଶ ଓଡ଼ିଆ ଅଲ୍ ଆର୍ ଅଣ୍ଡରଷ୍ଟାଣ୍ଡିଂ ଇନ୍ ଓଡ଼ିଆ
Yes, ma'am.
ଓକେ ବହୁତ ସାରା ଯୋଉ ବଏଜ ଆଣ୍ଡ ଗର୍ଲସ ମାନେ ଥାଆନ୍ତି ସେମାନଙ୍କର ଇଟିଂ ହ୍ୟାବିଟ ସେମାନେ ପ୍ରିଫର କରନ୍ତି ବାହାରେ ଖାଇବା ପାଇଁ ଫାଷ୍ଟ ଫୁଡ ହୋଟେଲ ଇନ୍ ଦ୍ୟାଟ୍ ଟାଇମ୍ ସେମାନେ ସେମାନଙ୍କର ଡାଏଟରେ ଇନକ୍ଲୁଡିଂ ନଥାଏ so many types of vegetables, roots and tubers, leafy vegetable, which is rich in calcium, which is rich in iron, because in that time adolescent period iron is most important. Iron plays a most important role in our body, so that they eat most often vitamins and mineral rich food. But in that time, recent time, adolescents are preferred most preferably outside food. Good mixtures of foods should be eaten at breakfast, lunch, and dinner. It may be nourishment for her body. A good breakfast always help adolescent to do well at studies, and active participate in sports and games during school period and college period and so many other activities. Sometimes this basic diet, which is known as balanced diet, if we include all food groups or different types of foods like cereals, pulses, vegetables, leafy vegetables, animal foods, milk and milk product, meat, fish, if we include all these different types of foods in our diet or meal planning, breakfast and lunch and dinner, it may be cheaper, clean, and more nourishing than the snacks or fast foods. But they are not acceptable, these foods, because they want to prefer fast food and prefer outside food, which is affect their food habit or health. Some nourishing snacks also they can prefer, who are in dieting they also prefer nourishing snacks are ground nuts, sprouted gram chats, jaggery sweets, and some fruit salad, fruit custard, pakoda. These are the popular snacks and gives all the nutrients to our body. Why iron is important? I tell you, Kohili, iron is most important in her diet during this period. Adolescent ମାନଙ୍କ ପାଇଁ iron why important? କି କହିପାରିବ? Iron basically hemoglobin prepare କରିବାରେ ଆମ ବଡିରେ hemoglobin କୁ ତିଆରି କରିବାରେ iron most important role play କରିଥାଏ. Basically adolescent girls mane who are menstruating they for their life cycle and for during this period iron is most important. What are the iron rich food? Iron rich foods are meat, liver, whole pulses, dark green leaves. Particularly dark green leaves are drumstick leaves, spinach, amarnath. These are the dark green leaf, and jaggery also rich in iron. These iron rich foods and also fruits like orange, guava, amla are the vitamin C rich food because vitamin C are especially good for the absorption of iron or metabolism of iron. Iron metabolism karibaare vitamin C most important role play kariଥାଏ. When the body cannot absorb or we cannot use the iron in the diet very well, an adolescent girl or the boys may become anemic. Where we discuss about due to menstruating, adolescent girls face so many problems, but boys, why they are need iron rich food? Because some boys are also lose iron because when they are active in sports and sweat a lot. For this reason, they need so much of iron. Who need who needs special attention during this period? क्योंकि adolescents माने एई adolescent period रे special attention को need करिथांती. The adolescent who does not consume milk, basically girls. Girls are not interesting. Boys also are not interested to consume milk because and nowadays so many girls and boys are vegetarian. So that a very strict vegetarian diet in low income families include no foods or include no basic food groups from animals including milk, milk product and those who are vegetarian they are not including meat, fish, egg, so they face problems for iron means ସେମାନେ ବହୁତ ସାରା ପ୍ରୋବ୍ଲେମ ଫେସ୍ କରନ୍ତି ଯେତେବେଳେ ଆମ ବଡିରେ inadequate amount ରେ ଆଇରନ୍ କମିଯାଏ ସେମାନେ ବହୁତ ସାରା ପ୍ରୋବ୍ଲେମ ଫେସ୍ କରନ୍ତି ଯେମିତିକି ଆନେମିଆ ହେଲା ଆଣ୍ଡ ସେମାନଙ୍କର ହେଡାକ୍ ହବା ଆରମ୍ଭ ହେଇଯାଏ ଇରିଟେଟେଡ୍ ଫିଲ୍ କରନ୍ତି during this period they are very aggressive जोटा अनप्लीजेंट बिहेवियर आमे जाहाकू कहि परिबा जो दोज आर नॉट प्लीजेंट बिहेवियर सेमानकर एटीट्यूड रे चेंज होई थाए बिहेवियर रे चेंज होई थाए ओके एंड आल्सो सम एडोलेसेंट्स आल्सो फूड हैबिट्स भीतर से माने हैबिचुअल हे जाय थांती हॉट एंड hot tea, and coffee. They take in so many times in a day. And this hot coffee and tea taken shortly before taking foods rich in iron interferes with iron and calcium absorption टाकू आउ हमर आयरन absorption बा आयरन मेटाबॉलिज्म को कमेई दिए किए जदि so many times आमे कौन करिबा ना हॉट टी एंड कॉफी को टेकन करिबा इन ए डे रे आ बहुत सारा एडोलेसेंट माने नाउ ए डे से माने प्रिफर भी कलेनी एसबू जिनस आ मोर गोटे एक्चुअली मुझे कहवाक भी चाहिए बुझेबा चाहिए जे आमर गोटे रिसर्च भी थिला मु भी ता ऊपर रिसर्च करी एडोलेसेंट गर्ल्स मानकर फूड हैबिट्स न्यूट्रिशनल प्रेफरेंसेस एंड देयर बॉडी इमेज satisfaction level. Nowadays, in this research, we find out that adolescent boys are more concerned about their body image satisfaction level. ସେମାନେ ବହୁତ ସାରା concern ଥାନ୍ତି ଯେ ଆମେ ସ୍ଲିମ୍ ରହିବୁ ଆମର ଫିଗର ବଡି ଇମେଜ ସାଟିସ୍ଫାକ୍ସନ ଆମର ସମସ୍ତଙ୍କର ଆଉଟଫିଟ୍ ଆମର ଲୁକିଂ ଭେରି ଗୁଡ୍ ରହିବ ବଟ୍ ଇନ୍ ଦ୍ୟାଟ୍ ଟାଇମ୍ ସେମାନେ ଇନକ୍ଲୁଡେଡ୍ କରନ୍ତି ନାହିଁ ତାଙ୍କର ବା ଫୁଡ୍ ହ୍ୟାବିଟ୍ କୁ ଚେଞ୍ଜ କରନ୍ତି ନାହିଁ ତାଙ୍କର ସେମାନେ ବେଳେ ବେଳେ କଣ କରନ୍ତି କେତେବେଳେ ତାଙ୍କର ମିଲ୍ ସ୍କିପ୍ କରି ଦିଅନ୍ତି ଡ୍ୟୁ ଟୁ ଲ୍ୟାକ୍ ଅଫ୍ ଟାଇମ୍ ବେଳେ ବେଳେ ତାଙ୍କର ପାଖରେ ଆଭେଲେବୁଲ ନଥାଏ ଯୋଉଗୁଡିକ ଖାଇବା ଯେମିତି କି ଲଞ୍ଚ ଡିନର ସେମାନେ ଠିକ ଭାବରେ କରିପାରନ୍ତି ନାହିଁ ସେମାନେ ସେଇ ଜାଗାରେ ଯେହେତୁ ତାଙ୍କୁ ହଂଗ୍ରି ଫିଲ୍ କରନ୍ତି ସେମାନେ ସେଇ ଜାଗାରେ ସ୍ନାକ୍ସ କୁ ପ୍ରିଫର କରନ୍ତି all are understand my point of view
Yes,
if
ma'am.
any problem then I can change or talk in only English
No, ma'am.
ତ ସେଇ ଜାଗାରେ ସେମାନେ କଣ କରନ୍ତି ଯେତେବେଳେ ତାଙ୍କ ବଡି ଇମେଜ ସାଟିସ୍ଫାକ୍ସନ ଲେଭେଲକୁ ପ୍ରିଫର କରିବା ପାଇଁ ସେମାନେ ସବୁ ପ୍ରକାରର ଫୁଡ ହ୍ୟାବିଟ୍ କୁ ମଧ୍ୟ ଚେଞ୍ଜ କରିଥାନ୍ତି ସମ୍ ଆଡୋଲେସେଣ୍ଟ ଗାର୍ଲସ ଆର୍ ଡୋ ନଟ୍ କନଜ୍ୟୁମ ମିଲ୍କ ଆଣ୍ଡ ମିଲ୍କ ପ୍ରଡକ୍ଟ ସେମାନେ ସେଇ ଜାଗାରେ କୋଉଠୁ ପାଇବେ ଅଧିକ ପରିମାଣର ପ୍ରୋଟିନ which are help us to body building and ସେମାନେ କ୍ୟାଲସିୟମ କୁ କୋଉଠୁ ପାଇବେ ଅଧିକ କ୍ୟାଲସିୟମ they are not also consume green leafy vegetables and that time they face anemic undernourishment malnutrition underweight in that time ଯଦି ଆମେ ସେଇ ସମୟରେ କଣ କରିବା ତାଙ୍କର BMI calculation କରିବା ବହୁତ ଜଣଙ୍କର either overweight ଆସେ ନହେଲେ underweight ଆସେ overweight ମଧ୍ୟ ସେଇ ସେମ୍ ସିଚୁଏସନ ପାଇଁ ଆସେ ଯଦି ଆମେ ଠିକ ଟାଇମ ଟୁ ଟାଇମ ଇଟିଂ ହ୍ୟାବିଟ୍ ବା ଆମର ହାବିଚୁଆଲ ଚେଞ୍ଜ କରୁଛେ ଟାଇମ ଟୁ ଟାଇମ ଖାଇପାରୁନେ ମନେକର ଗୋଟେ ଦିନ ଜଣେ ଖାଇଥିବ ଲଞ୍ଚ ଗୋଟେ ବେଳେ କରିଥିବ ଆଉ ଗୋଟେ ଦିନ ସେମଟା ନେକ୍ସଟ ଡେ କରିବ 4ଟାରେ କି 5ଟାରେ ନେକ୍ସଟ ଡେ 11ରେ ଯେତିକି ଖାଇଥିବ ଆଉ ଖାଇଲା ବେଳକୁ ଇଭିନିଂ 5-6 ସେଇ ସିଚୁଏସନରେ ମଧ୍ୟ ଆମର ମେଟାବଲିଜମ ଠିକ ଭାବରେ ହେଇନଥାଏ ଆଇଦର ଅଣ୍ଡରୱେଟ୍ ହୁଏ ନହେଲେ ଓଭରୱେଟ୍ ହୁଏ ଓକେ ଦିସ୍ ଆର୍ ଦ ଫର୍ଷ୍ଟ ଆମେ କାହାକୁ ବେଶୀ ସ୍ପେଶାଲ ଆଟେନସନ ଦବା those adolescent who does not consume milk second is pregnant adolescent and adolescent girls who becomes pregnant need plenty of extra nourishment because she is still growing and at the same time they nourishing a growing baby so they need properly care and proper nutrition or extra or adequate nutrition and ସେମାନଙ୍କୁ ଆମକୁ special attention ମଧ୍ୟ ଦବାକୁ ପଡେ next the adolescent with a disease related to nutrition those who adolescents କୌଣସି ପ୍ରକାରର ନ୍ୟୁଟ୍ରିସନାଲ ଡିଜିଜ କୁ ପ୍ରିଫର କରୁଥିବେ ଫର ଏକ୍ସାମ୍ପଲ ବେସିକାଲି ନାଓ ମାନେ ବର୍ତ୍ତମାନ ଦେଖିବାକୁ ଗଲେ ଗୋଟେ ଟେଷ୍ଟ ଅଫ ଭ୍ୟୁ ରୁ ଜଣା ପଡିଥିଲା ଯେ ସେମାନେ ବେସିକାଲି କଣ ରହୁଛନ୍ତି ନା ଆଡୋଲେସେଣ୍ଟ ଗର୍ଲସ ମାନଙ୍କର ହିମୋଗ୍ଲୋବିନ ଲେଭେଲ କମ ରହୁଛି ବିକଜ ଆଇରନ୍ ଡେଫିସିଏନ୍ସି ରୁ ଆନେମିଆ ହଉଛି ତାଙ୍କର ହିମୋଗ୍ଲୋବିନ ଲେଭେଲ କମ ରହୁଛି ଓକେ ତ ଇନ୍ ଦ୍ୟାଟ୍ ଟାଇମ୍ସ ନ୍ୟୁଟ୍ରିସନାଲ ଡେଫିସିଏନ୍ସି ଯୋଉଗୁଡିକ ରହିଲା and adolescents with diabetes it also rich in carbohydrate ଅଧିକ ରହିବାରୁ ମିଠା ଅଧିକ ହେବାରୁ diabetes ହଉଛି hypertension, blood pressure madhya, and or heart disease. They are preferred or watch their diet carefully. ସେମାନଙ୍କର diet କୁ ଆମକୁ special attention ଦେବାକୁ ପଡେ। ଆଉ ବର୍ତ୍ତମାନ ବି ଆଉ ଗୋଟେ ରିସର୍ଚ୍ଚରୁ ଜଣା ପଡିଥିଲା ଯେ ଆମର ରିସେଣ୍ଟଲି adolescent girls and boys ମାନେ ଅଧିକ ହାଇପରଟେନସନ ରହୁଛନ୍ତି ଏବଂ ଡାଇବେଟିକ ମଧ୍ୟ ରହୁଛନ୍ତି। So adolescents should be deal with carefully because they are sensitive and they like to be independent. In that type, adolescents are also always preferred to be independent. Next, after adolescent, aging. During adulthood and aging, these are the different period. But aging is known as old aging. But adulthood is also classified three categories. Which period to which period is known as adulthood? And aging is old or old age, which period, which year to which year? Can anyone explain? Adulthood we know known as 20 to 60. This period or this year is known as adulthood. After 60, we know this period is old age or aging. Okay. Adulthood are also three types. Early adulthood, middle adulthood, and late adulthood. 20 to 30 is known as early adulthood, in which period a adolescent change her lifestyle. They want to job, they want to freedom, and girls also marry and settle another house and another place. So this is also a changing period. After that, 30 to 40 is known as middle adulthood. In that period, adults are very responsible in her family, in her office, and so many places. They are very in her societies. They are very responsible. And third, late adulthood. They are known all the things and they do all the activities. So these also in that period also their nutritional requirement plays a very important role. And during this period, adults face so many problems like different disease, disabilities, ଯୋଉଗୁଡିକ କି ଆମର ବିଭିନ୍ନ ଡାଏଟାରୀ ଇନଟେକ୍ ଦ୍ୱାରା ସେମାନେ ବହୁତ ସାରା ପ୍ରୋବ୍ଲେମକୁ ମଧ୍ୟ ସଲ୍ଭ କରିପାରନ୍ତି। ଯୋଉଗୁଡିକ ଡିଜାବିଲିଟିସ୍ ରହିଲା ଏ ସମୟରେ ବହୁତ ସାରା ଯୋଉ ଆମର ନାଇଟ୍ ବ୍ଲାଇଣ୍ଡନେସ୍ ଆସେ, ଆମର ଆଇଜ୍ର ପାୱାର ଅପ୍ ଆଣ୍ଡ ଡାଉନ୍ ହେଇଥାଏ, ଦ୍ୟାଟ୍ ପାଇଁ ସେଥିପାଇଁ ମଧ୍ୟ ଭିଟାମିନ୍ ଏ ଡେଫିସିଏନ୍ସିରୁ ଏସବୁ କାରଣରୁ ହେଇଥାଏ। ଏବଂ ଜଲ୍ଦି ଜଲ୍ଦି 50-60 ଆଫ୍ଟର ଏଜିଂ ଯେତେବେଳେ 50-60 ଇୟର୍ସ ବେଳକୁ ସେତେବେଳକୁ କ'ଣ ହୁଏ ନା କିଛି ଲୋକଙ୍କର କିଛି ପ୍ରୋବ୍ଲେମ ପାଇଁ ଚୁଟି ଝଡ଼ିଯାଏ, ଲସ୍ ଅଫ୍ ଟିଥ୍ ହେଇଯାଏ, ସେମାନେ ଠିକ ଭାବରେ ଚିଉ କରିପାରନ୍ତିନି ବା ଠିକ ଭାବରେ ଖାଇପାରନ୍ତିନି। ଏବଂ ସୋସିଆଲ ଆଫେକ୍ଟ କ'ଣ ଥାଏ, ସେମାନେ ଆଫ୍ଟର 50 ଇୟର୍ସ ଦେ ଫେସ୍ ଲୋନଲିନେସ୍, ସୋସିଆଲ ଆଇସୋଲେସନ, ତାଙ୍କର ଇନକମ୍ ମଧ୍ୟ କମିଯାଏ। ଆଫ୍ଟର 60 ସେମାନଙ୍କର ଇନକମ୍ କମିଯାଏ। And also in the same time they face so many psychological problem because 50 to 60 years ଭିତରେ ଇଏ ବି ଗୋଟେ ରିସର୍ଚ୍ଚରୁ ଜଣା ପଡ଼ିଥିଲା। In that period 50 to 60 years ଭିତରେ ବହୁତ ଜଣ ମ୍ୟାନ୍ ଆଣ୍ଡ ଓମେନଙ୍କର ବ୍ଲଡ୍ ପ୍ରେସର ଆଇଦର ହାଇ ବିପି ଅର୍ ଲୋ ବିପି maximum 100 ରୁ 80 ଆମେ ଯୋଉଟା 80% ବୋଲି କହୁଛେ 80% ଲୋକଙ୍କର ସେଟା ବାହାରିଥିଲା। ଓକେ, ତ ୟା ପରେ ଆସିଯିବା ଆମେ ଓଲ୍ଡ ଏଜ୍। ଓଲ୍ଡ ଏଜ୍ ରେ ସେମାନେ କେମିତି ପ୍ରୋବ୍ଲେମ ଫେସ୍ କରନ୍ତି বা how they manage their nutritional status during the old age, ସେମାନେ କେମିତି balanced କରିବେ, because they in that period aging after 60 years they reduce their activities, so there is a need to cut down the calories, ସେମାନଙ୍କର କ୍ୟାଲୋରୀ ରିକ୍ୱାରମେଣ୍ଟ କମେଇବାକୁ ପଡେ, କାର୍ବୋହାଇଡ୍ରେଟ ର ଆମାଉଣ୍ଟ କମେଇବାକୁ ପଡେ, ଆଉ ତାଙ୍କର ବାଲାନ୍ସଡ ଡାଏଟ ଠିକ ଭାବରେ ସେମାନେ ବାଲାନ୍ସଡ କରନ୍ତି। ଦେ ସୁଡ୍ ଅଲସୋ ରିଡ୍ୟୁସ ଇନଟେକ୍ ଅଫ ଫ୍ୟାଟ୍ସ, ବିକଜ ଦେୟାର ଡାଇଜେଷ୍ଟିଭ ସିଷ୍ଟମ ମଧ୍ୟ କାମ କରିବା ଟିକେ ଆସ୍ତେ ଆସ୍ତେ ତାଙ୍କର ପ୍ରୋବ୍ଲେମ ଦେଖାଏ। ଦେନ୍ ସୋ ଫ୍ୟାଟ୍ ଆଉ ସୁଗାର ଠିକ ଭାବରେ ଡାଇଜେସନ ହେଇପାରେ ନାହିଁ particularly, so they need to cut down the calories and they reduce to intake of fats and sugar in particularly. Due to poor digestion and constipation might occur during this period, so they not and also ତାଙ୍କର ସେମାନଙ୍କର ଏ ସମୟରେ ଯେହେତୁ ଲସ୍ ଅଫ୍ ଟିଥ୍ ଥାଏ, ସେମାନେ ଚିଉ କରିପାରନ୍ତିନି ଠିକ ଭାବରେ, ସେମାନଙ୍କର ଡାଇଜେସନ କାମ କରେନି, ତେଣୁ ତାଙ୍କୁ ସେଇ ସମୟରେ ଯୋଉ ଗୁଡ଼ିକ ଚିଉ ନ କରିପାରିଲା ଭଳିଆ ଅଲ୍ଟରନେଟ୍ ୱେ, ଫର ଏକ୍ସାମ୍ପଲ ମାଷ୍ଟ ଫ୍ରୁଟ, ଯୋଉଟା ପାଚି ଯାଇଥିବ ସେ ଫଳକୁ ଆମେ ମାଷ୍ଟ କରିକି ଦେଇପାରିବା, ଫ୍ରୁଟ ଜୁସ୍ ଦେଇପାରିବା, ଅଲ୍ଟରନେଟ୍ ୱେରେ ତାଙ୍କୁ ସୁପ୍ ବି ଦେଇପାରିବା, which are helpful for her body. Okay, this period also ସେମାନେ ଏଇ ସମୟରେ ବହୁତ ଓରି ଥାନ୍ତି and they cause psychological problem, ସେମାନେ ଟେନସନରେ ଥାନ୍ତି, ମୁଁ ଯୋଉ କହିଲି ହାଇପରଟେନସନ ବଢି ଯାଇଥାଏ due to low income, ସେମାନଙ୍କର low income and loneliness, some pressure, ଏଇ କାରଣରୁ ସେମାନେ କଣ କରିଥାନ୍ତି ନା ବେସିକାଲି ଟେନସନ ଫେସ୍ କରିଥାନ୍ତି। Then what are the nutritional problem during the old age? What are the nutritional problem? The nutrients mostly to be deficient in the diet of an elderly person are vitamin C deficiency ଦେଖେଇଥାଏ, B complex vitamin and କେତେବେଳେ ସମସ୍ତେ priorities ରେ ଦେଖିବ, ଯୋଉ ଓଲ୍ଡ ଏଜ୍ ମାନେ ହସ୍ପିଟାଲ ମେନଲି ଯାଇଥାନ୍ତି, ହସ୍ପିଟାଲର ମେଡିସିନ ସାଥିରେ ସେମାନଙ୍କୁ କମ୍ପଲସରି ଭିଟାମିନ ବି କମ୍ପ୍ଲେକ୍ସ ଟାବଲେଟ ଦିଆଯାଇଥାଏ, ବିକଜ ଇନ୍ ଦ୍ୟାଟ୍ ପିରିୟଡ ତାଙ୍କୁ ଭିଟାମିନ ବି କମ୍ପ୍ଲେକ୍ସ ରିଚ୍ ଫୁଡ ଦରକାର ପଡେ, ଯୋଉଟା କି ଭିଟାମିନ ବି କମ୍ପ୍ଲେକ୍ସ ଫୁଡ ସଫିସିଏଣ୍ଟ ଯେହେତୁ ତାଙ୍କ ବଡି ପାଇଁ ହୁଏ ନାହିଁ, ତେଣୁ ଭିଟାମିନ ବି କମ୍ପ୍ଲେକ୍ସ ଟାବଲେଟ ତାଙ୍କର ପ୍ରତିଟି ଡିଜିଜ୍, ଇଏ ବି ଗୋଟେ ସର୍ଭେରୁ ଫାର୍ମାସିଷ୍ଟ ସର୍ଭେରୁ ବି ଜଣା ପଡିଥିଲା, ପ୍ରତି ଡିଜିଜରେ ସେମାନେ ଗୋଟେ ଆଡ୍ କରିଥିବେ, ମେଡିସିନ ସ୍ପେଶାଲିଷ୍ଟ ହୁଅନ୍ତୁ, ତୁମର ଡେଣ୍ଟିଷ୍ଟ ହୁଅନ୍ତୁ, ଏଣ୍ଡୋକ୍ରାଇନୋଲୋଜି ହୁଅନ୍ତୁ, ଅର୍ଥୋପେଡିକ ହୁଅନ୍ତୁ, ସେମାନେ ବି କମ୍ପ୍ଲେକ୍ସ ଭିଟାମିନ୍ସ ମେଡିସିନ ନିହାତି ଆଡ୍ କରିଥିବେ। ଏଇଟା ଗୋଟେ ନ୍ୟୁଟ୍ରିସନାଲ କମନ ନ୍ୟୁଟ୍ରିସନାଲ ପ୍ରୋବ୍ଲେମ ଡ୍ୟୁରିଂ ଦ ଓଲ୍ଡ ଏଜ୍। ଦିସ୍ ମାନେ ଏଲ୍ଡରଲି ପିରିୟଡରେ ବା ଓଲ୍ଡ ଏଜ୍ ପିରିୟଡରେ ଏଇଟା ମୋଷ୍ଟ କମନଲି ସେମାନଙ୍କର ଏଇଟା ହେଇଥାଏ। ତ how to guide or care of malnourished during this period, ଆମେ କେମିତି ସେମାନଙ୍କୁ ଗାଇଡ କରିବା ବା ତାଙ୍କର କଣ କରିପାରିବା, how we guide them or care them? First, We can analyze their food habit carefully. First of all, elderly person kara ame first analyze kariba what are their food habit. Try to find out the patient's or the oldest person's personal attitude, their living condition, and its limitation or available options. ସେମାନଙ୍କ ପାଖରେ କଣ ତାଙ୍କର ଫୁଡ୍ ହାବିଟ୍ସ କଣ ରହୁଛି, ତାଙ୍କର ଆଟିଚ୍ୟୁଡ କଣ ରହୁଛି, ତାଙ୍କର ଲିଭିଂ ସିଚୁଏସନ କଣ ରହୁଛି, ଏସବୁ ଜିନିଷକୁ ଫର୍ଷ୍ଟ ଆମକୁ ଆନାଲାଇଜ କରିବା ପାଇଁ ପଡିବ. Then which type of foods they need, the nutritional needs can be met with varieties food. ଆମକୁ ଫାର୍ଷ୍ଟ ଦେଖିବାକୁ ପଡିବ କୋଉ ନ୍ୟୁଟ୍ରିସନ ତାଙ୍କ ପାଖରେ ଡେଫିସିଏଣ୍ଟ ଦେଖାଯାଉଛି, କୋଉ ଫୁଡ କୁ ସେମାନଙ୍କ ପାଖରେ ପହଞ୍ଚି ପାରୁନି, ଯୋଉ ଫୁଡ ରେ କି ହାଇ ରିଚ୍ ର କୋଉ ନ୍ୟୁଟ୍ରିଏଣ୍ଟସ ରହୁଛି. After that analyze, we can suggest they can adopt these foods which are rich in these nutrients. ଯେମିତିକି ଭିଟାମିନ୍ ବି କମ୍ପ୍ଲେକ୍ସ, ଭିଟାମିନ୍ ବି କମ୍ପ୍ଲେକ୍ସ ରିଚ୍ ଫୁଡ୍ସ ଗୁଡ଼ିକୁ ଆମେ ତାଙ୍କୁ ପ୍ରେସ୍କ୍ରାଇବ୍ କରିପାରିବା. ଫର ଏକ୍ସାମ୍ପଲ୍, all vegetables are rich in vitamin B complex. Vitamin B1 thiamine, B2 riboflavin, B3 niacin. These are जो B complex, B6, B12, ये ସବୁ ଗୁଡ଼ିକ vitamins ଆଉ minerals ଆମକୁ all green leafy vegetables and vegetables. ସେଥିପାଇଁ old age person ମାନଙ୍କୁ ଅଧିକ vegetable stew, ସନ୍ତୁଳା କିମ୍ବା ସମସ୍ତ ପ୍ରକାରର vegetable mix କରିକି ତାଙ୍କୁ ଦିଆଯାଏ ଡାଏଟରେ, ଡିନରରେ ବି ଲଞ୍ଚରେ ବି. ଏକ୍ସେସ୍ ଆମାଉଣ୍ଟ ସିରିୟଲ୍ସ ଆଉ ଫ୍ୟାଟ୍ସ ଅପେକ୍ଷା ଆମକୁ ଅଧିକ ପ୍ରୋଟିନ ଅପେକ୍ଷା, ପ୍ରୋଟିନ ବି ସଫିସିଏଣ୍ଟ ଆମାଉଣ୍ଟର ଦିଆଯାଏ, ତା ଛଡା ଆମକୁ ଅତ୍ୟଧିକ ଲିଫି ଭେଜିଟେବଲ୍ସ ଆଉ ଭେଜିଟେବଲ୍ସକୁ ମଧ୍ୟ ପ୍ରେସ୍କ୍ରାଇବ୍ କରାଯାଏ. And also, first we can analyze their food habits. After that, never moralized. It means eat this because it's good for you. ଆମେ ତାଙ୍କୁ କହିବାନି ଯେ ଏଇଟା ଖାଅନି ସେଟା ଖାଅନି, ତମେ ଏଇଟା ଖାଅ because it is good for you is what people generally say the elderly. ଏଇଟା ସମସ୍ତେ କହନ୍ତି ନା, ସମସ୍ତେ ଏଇଟା ଖାଅ ଏଇଟା ତମ ପାଇଁ ଭଲ. But it has little value for anyone. ଯେତେବେଳେ ଆମେ ବାରମ୍ବାର ସେଇ ଜିନିଷଟା ଆମେ ତାଙ୍କୁ କହିଦେବା, ସେମାନେ କହିବେ ମାନେ କଣ ଏଇ ଜିନିଷଟାକୁ କହୁଛନ୍ତି, but if ମାନେ it means ସେମାନେ ଆମକୁ ଠକୁଛନ୍ତି. And some people ଏମିତି psychological belief ନେଇକି ମଧ୍ୟ ସେମାନେ ଖାଇବା ପିଇବା ଠିକ ସେ କରନ୍ତିନି. And sometimes they facing economic problem also, that also psychological problem, and also they face economic problem, and also they face some social problem. ସେମାନଙ୍କୁ ସମୟ ହୁଏନି, କେତେବେଳେ କୋଉଠି କୌଣସି ଜିନିଷ ମିଳେନି ଯୋଉଟା ସେମାନେ ଚାହୁଁଥିବେ. ସେଇ ଜାଗାରେ ଆମେ ତାଙ୍କୁ ନେଭର ମୋରାଲାଇଜଡ, ଆମେ ତାଙ୍କୁ ଡିମୋରାଲାଇଜଡ କରିବା ନାହିଁ. And after that, ଯେତେବେଳେ ଆମେ ତାକୁ ଡିମୋରାଲାଇଜ ନ କରିବା, ତାହେଲେ what can we do? We encourage variety in foods consumed. ଆମେ ତାଙ୍କୁ encourage କରିବା varieties of foods consume, seasonal foods को consume କରିବା ପାଇଁ, and also ଆମେ ତାଙ୍କୁ ସେମାନେ ବହୁତ ସାରା ଜାଣିଥିବେ, ମାନେ ସେମାନେ କହିବେ ସିଝା ଖାଇବେନି, ଆଟ୍ରାକ୍ଟିଭ ନଥିବେ, ବ୍ଲାଣ୍ଡ ଡାଏଟ୍ ଖାଇବା ପାଇଁ ସେମାନେ ଜମା ଇଣ୍ଟରେଷ୍ଟିଂ ନଥିବେ. ବଟ୍ ଆନ୍ ଦ୍ୟାଟ୍ ଟାଇମ୍ ଆମେ ତାଙ୍କୁ ପ୍ରେସ୍କ୍ରାଇବ୍ କରିବାକୁ ପଡ଼ିବ ନ୍ୟୁ ଟେଷ୍ଟ ଆଡ୍ କରିକି, ସିଜନାଲ ଫୁଡ୍ ଆଡ୍ କରିକି. ଯେହେତୁ ଆମକୁ ଏଇ ସମୟରେ, ଓଲ୍ଡ ଏଜ୍ ସମୟରେ ଆମକୁ କ'ଣ କରିବାକୁ ପଡ଼ିଥାଏ, ବ୍ଲାଣ୍ଡ ଡାଏଟ୍ ପ୍ରେସ୍କ୍ରାଇବ୍ କରିବାକୁ ପଡ଼ିଥାଏ. ନୋ ସ୍ପାଇସେସ୍, ନୋ ଫ୍ୟାଟ୍, ନୋ ଅଏଲ୍, नो साल्ट, ଏସବୁ ଜିନିଷ ଟିକେ ଟିକେ ଆଭଏଡ୍ କରିକି ତାଙ୍କୁ ବ୍ଲାଇଣ୍ଡ ଡାଏଟ୍ ଯେତେବେଳେ ପ୍ରେସ୍କ୍ରାଇବ୍ କରିବାକୁ ପଡ଼ିଥାଏ, ସେଇ ସମୟରେ ଆମକୁ ତାଙ୍କୁ କ'ଣ କରିବାକୁ ପଡ଼ିଥାଏ ନା ଏନକରେଜ୍ କରିବାକୁ ପଡ଼ିଥାଏ ଡିଫରେଣ୍ଟ ଫୁଡ୍ ସହ ଅଲ୍ ଭେଜିଟେବଲ୍ସ ଆଣ୍ଡ ଲିଫି ଭେଜିଟେବଲ୍ସକୁ ତାଙ୍କ ଡାଏଟ୍ରେ ଇନକ୍ଲୁଡ୍ କରିବାକୁ ପଡ଼ିଥାଏ. ଆଣ୍ଡ ସମଟାଇମ୍ସ smaller amount of foods and more frequent mini meals also we can provide because ତାଙ୍କୁ ତ ଆମେ ଏକାଥରେ କି ବହୁତ ସାରା ଖାଇବା ଦେଇପାରିବା ନାହିଁ। ସମ୍ ଡିଜିଜ୍ ସେଇ ସମୟ ବେଳକୁ ବହୁତ ସାରା ଡିଜିଜ୍ ଓଲ୍ଡ ଏଜରେ ଅକର ହେଇଥାଏ ବା ଦେଖାଯାଇଥାଏ। ତ ତାଙ୍କ ଡିଜିଜ୍ ଅନୁସାରେ ଆମର ଡାଏଟ୍ ପ୍ଲାନିଂ କରିବାକୁ ପଡ଼େ। ତାପରେ ତାଙ୍କର କୋଉ ଫୁଡ୍ସଟା ଇନକ୍ଲୁଡେଡ୍ ଥାଏ, କୋଉ ଫୁଡ୍ସ ଆଭଏଡେଡ୍ ଥାଏ, ତାଙ୍କ ଡିଜିଜ୍ ଅନୁସାରେ ଆମକୁ ସେଇଟାକୁ ମଧ୍ୟ ପ୍ରିଫର କରିବାକୁ ପଡ଼େ ବା ଦେଖିବାକୁ ପଡ଼େ। And at that time also, avoid unnecessary drugs and be informed about the action of each drug they do take. ସେମାନେ ଯୋଉ ଡ୍ରଗ୍ ଯୋଉ ଆଲକୋହଲ କନଜ୍ୟୁମ୍ କରୁଛନ୍ତି ତାଙ୍କୁ ଆଭଏଡ୍ କରିବାକୁ କୁହାଯାଏ, ପ୍ରେସ୍କ୍ରାଇବ୍ କରାଯାଏ ବା ତାକୁ ଆଭଏଡ୍ କରାଯାଏ ଆଣ୍ଡ ତାଙ୍କୁ ଇନଫର୍ମ କରାଯାଏ ଯେ କରାଯିବା ଆବଶ୍ୟକ, ଯାହାଫଳରେ ସେମାନଙ୍କର ଇଣ୍ଟରେଷ୍ଟ ଚେଞ୍ଜ ହେବ, ତାଙ୍କର ବିହେଭିଅର ଚେଞ୍ଜ ହେବ, ତାଙ୍କର ଆଟିଚ୍ୟୁଡ୍ ଚେଞ୍ଜ ହେବ, ଯାହାଫଳରେ ସେମାନଙ୍କର ସେ ଡ୍ରଗ୍ସ କନଜ୍ୟୁମ୍ କରିବା ଦ୍ୱାରା କ'ଣ କ'ଣ ତାଙ୍କର ରିଆକ୍ସନ୍ ହେଉଛି, କ'ଣ କ'ଣ ପ୍ରୋବ୍ଲେମ୍ ହେଉଛି, ସେଟା ତାଙ୍କୁ ଆମକୁ କ'ଣ କରିବାକୁ ପଡ଼େ ନା ଇନଫର୍ମ କରିବାକୁ ପଡ଼େ। So that the proper nutrition is necessary for maintaining. These are the lifespan, different lifespan, and their nutritional requirement. So, proper nutrition is necessary for maintaining good health and for building good health during and after an illness. After illness pore or different lifespan re amara proper and necessary ଥାଏ maintaining for good health. Using diet, ଆମେ diet କୁ use କରିକି ତାକୁ ମଧ୍ୟ prevent କରିପାରିବା. Using diet to care or control the disease is called diet therapy. ଆମେ diet ଦ୍ୱାରା ଯୋଉ disease କୁ prevent କରିପାରିବା ବା ଯୋଉ disease କୁ ଯୋଉ illness କୁ control କରିପାରିବା ବା ଯୋଉ disease କୁ control କରିପାରିବା, that is known as diet therapy. Another way, diet therapy means modifying or changing the normal diet or changing the normal diet or dietary habits. Day to day life रे आमे normal थिला बेले जो diet को prescribe करूचे ताकू modified करिबा and some nutrients included करिबा सथिरे किछि changes करिबा. Which food included, more amount, which food avoided, ସେଇ ସବୁ ଜିନିଷକୁ ପ୍ରିଫର କରିବା and modifying or changing the normal diet in order to meet requirements created by disease or injury. These are called therapeutic diet. How we modified the normal diet? ଆମେ ଗୋଟେ normal diet କୁ କେମିତି modify କରିବା? How can we modify? Can anyone explain? କହିପାରିବ କେମିତି ଆମେ normal diet କୁ modified କରିପାରିବା? For example, in fever or some illness period, we may be increased or decrease the calories. Because during the obesity, we can decrease the calories, carbohydrate-rich food. During the malnourished or undernourished, underweight, and that time we increase the calories, carbohydrate rich food, fat rich food, which can give us energy. Energy is calculated by calories. Energy को आमे calculate करूचे कहा माध्यमरे calories माध्यमरे एति calorie energy दरकार तो এইভଳି ଭାବରେ ଆମେ କୋଉ ଜାଗାରେ ଆମର ଦରକାର କୋଉ ଜାଗାରେ ଦରକାର ନୁହେଁ ସେ ଅନୁସାରେ ଫାର୍ଷ୍ଟ ମଡିଫାଏଡ କରିବା increase or decrease କରିକି different nutrients को then how certain foods may be omitted as in case of allergy यदि in case of काहाको allergy अछि then we can modify certain nutrients and sometimes like post operate period in that time we can in the term of consistency it means we can be made such as liquid and soft dyes we can provide after operation after surgery we can provided first clear liquid diet first days or some hours. After that, we can provide a full fluid diet. 1 or 2 days, we can provide total liquid diet. After, we can provide sub diet. Then, completely. After 7 days, we can provide it normal diet. These are the modification of normal diet. Okay. When planning a meal or when planning the meals for illness person or a sick person, which points need to be special consideration? कुकु point को हमको ध्यान दबाको पड़े. Which points? First of all, we must prefer food to be cooked simply without spices means bland diet because the digestive capability of the patient is an important factor. Second, meals should look attractive when we present these meals because बेले बेले कौन हुए जो जिनसटा हमको attractive देखा जाए सेगुड़िका हमको कौन करे cheerful दिए बा हमको मन को शांति दिए हमको बहुत सारा इंटरेस्ट दिए खुशी दिए so a patient must need to cheers and they feel more like to eating this type of food जदि ताको सुंदर देखा जीवो से पेशेंट को जे खाद्यटा बहुत सुंदर देखा जाउची and that time they prefer करिवो जे मते सेही खाद्य दिया जाओ so first point we prefer the foods to be cooked simply. Second point, meals should be look attractive when we present in front of the patient. Third, all serving dishes and equipment should be sparkling and clean. Should be sparkling and clean. And next point is serving should not be too large because last we discussed about we give some small meals or frequent meals, small amounts and frequent meals so that we serve should not be too large amount because large serving are not so attractive and the large serving foods are tend to be discourage a patient also. Especially the patient has no appetite ताको भोक हुए नहीं जदि आमे ठीक कम अमाउंट रे न देबा अधिक अमाउंट रे देबा देन ताकू भल देखा जाउ नथिबो तार ठीक भाबरे डाइजेशन हे नथिबो इंटरेस्ट नथिबो खाइबारे ताहाले से ठीक भाबरे सेटाको आमे कहबा नो appetite. In order to appeal to the patient, hot food must be served hot and cold foods cold. And also cheerfulness, cheerfulness, food's cheerfulness can improve patients' attitude and appetite. And when we provide the diet therapy or therapeutic diet, we should be individualized, keeping in mind the individual person's food habits, food preferences, socioeconomic background, effect of illness on appetite, digestive capability, and their nutritional requirement. We should keep in mind when we provide diet. Then what are the liquid diet? ମୁଁ କହିଥିଲି ଏବେ ଲାଷ୍ଟରେ ଯେ ଆମେ post operation period ରେ liquid diet provide କରିବା. What is liquid diet? ଆଉ ଆମେ ଏଇ liquid diet କେତେବେଳେ ଦେବା? Liquid diet we prescribe when the patient unable to tolerate solid food. This diet includes food which are liquid at room temperature. And I also discuss liquid diets are subdivided into two types. Which diet? ମୁଁ discuss କଲି କିଏ କହିବ? Liquid diet को ଦି ଭାଗରେ ବିଭକ୍ତ କରାଯାଇଛି? Can anyone? What are the two types of liquid diet? Anyone have no idea about liquid diet? Liquid diets are two types, clear fluid diet and full fluid diet. Clear fluid diets and full fluid diet. What is clear fluid diet? Clear liquid diet or clear fluid diets is composed mainly of water and carbohydrate. A clear liquid diet are composed mainly water and carbohydrate. Which period we can prescribe clear liquid diet? Clear liquid diet we can use in acute illness, after surgery and after acute vomiting or diarrhea. এই ପିରିୟଡରେ ଆମେ ତାଙ୍କୁ clear liquid diet ଦେଇପାରିବା. Then what is full fluid diet or liquid diet? What is full fluid diet? Full fluid diets contains all foods in the clear liquid diet but include more nutritious food. ଯାହା clear fluid diet ରେ ଅଛି ଆମେ ତା ସାଥିରେ more nutritious food କୁ ମଧ୍ୟ provide କରିପାରିବା. And this full fluid diet is given to the patient when the patient unable to swallow or tolerate solid food. It is free from cellulose and irritating condiments and also spices. We also add in this full fluid diet, protein content of the diet can be increased by adding egg, skimmed milk powder, and cured meat to soup. And it is also less sweet can be used in this diet. So the fulfilled diet can be nutritionally adequate. What is soft diet? What is soft diet? ମୁଁ କହିଥିଲି first we preferred clear liquid diet, then full fluid diet, then after that we prefer soft diet. The soft diet may be offered post-operative cases for patient with acute infection, gastrointestinal condition, or chewing problems. And this soft diet is very similar to the normal diet except the texture of the food has been modified. ଆମେ ଏଇ ସମୟରେ modified କରିପାରିବା କାହାକୁ ତାର texture କୁ. It means ଆମେ ତାଙ୍କୁ mass ଆକାରରେ ଦେଇପାରିବା କିଛି liquid ସେଥିରେ କିଛି soft diet add କରିପାରିବା fiber ଅଧିକ ରହିବନି fat ଅଧିକ ରହିବନି କୋଉଥିରେ soft diet ରେ. Generally, foods in the soft diet are mildly flavored, slightly seasoned food, and are prepared in easily digestible form. Small proportion should be given at the main meals with snacks in between. We can provide the soft diet in between main meals. And also, we also add in sub diet in our main meals. And this type of foods must be very soft. This is used when for various reasons, like I say, patient cannot chew, use the facial muscles. Okay. Then what is fever? What is fever? Fever is an elevation of body temperature of the normal body. The body usually our normal temperature केते डिग्री सेल्सियस and केते डिग्री फारेनहाइट थाए ताठू अधिक हेले आमे ताको फीवर बोली जानि थाओ जनरल
98.6 degree for women
okay very good
or
9
37 degree.
98.6 degree Fahrenheit or 37 degrees Celsius ରୁ ଅଧିକ ହେଲେ ଆମେ ସେଟାକୁ କଣ ଜାଣିବା ଫିବର ହୋଇଛି okay fever the body's response to infection by microorganism inflammation physiologic stress or unknown cases okay Fevers may be classified in acute cases, acute, chronic, and intermittent. Acute such as tonsillitis, influenza, acute fever ଯୋଉଗୁଡ଼ିକ example ରହିଲା tonsillitis, influenza, thyroid, measles, chicken pox, etc. Chronic such as tuberculosis and other long-term diseases. Intermittent such as malaria, dengue, these types. Okay. And the acute fever is sudden and severe during the short duration. Chronic fever's onset is usually slow and long term. In intermittent fevers, the symptoms may appear at intervals. Okay. During the fever period, in the case of more serious infections such as pneumonia, the energy requirement during this period, the energy requirement may be increased. How much? 50% energy requirement से समय हमको increased କରିବାକୁ पड़े because meet their nutritional requirement. Okay. A liquid diet is used initially for fevers with progression of a sub diet, then the regular diet as the appetite improves. When the liquid diet is used, vitamin supplements will be needed. Sub diet should be sub diet को type ର भी ହେଇଥିବ ମୁଁ କହିଛି soft भी ହେଇଥିବ and bland भी ହେଇଥିବ. Sub diet should be bland, easily digested and a soft consistency. What are the main principles in dietary management of prolonged fever? What are the main principles? First, the diet should be high in energy value because the patient should not be forced to take food. ଆମେ patient को force କରିପାରିବାନି. But all attempts should be made ensure intake of 2000 to 2500 calorie per day. ଆମର ଜଣେ ପେସେଣ୍ଟ କୁ ଫର ଏକ୍ସାମ୍ପଲ ଆମେ ଯଦି ଫ୍ରିକ୍ୱେଣ୍ଟଲି ମିଡ୍ ଆମେ ତ ଫୋର୍ସ କରିପାରିବାନି ଦେନ୍ ବଟ୍ ଆମେ ତାଙ୍କୁ 2000 ରୁ 2500 ମିଲ୍ ପର ଡେ କେମିତି ପ୍ରେସକ୍ରାଇବ କରିବା ହାଇ ଏନର୍ଜି ଭ୍ୟାଲୁ ଥିବା ଫୁଡ କୁ ପ୍ରେସକ୍ରାଇବ କରିକି ହିଁ ଆମେ ତାଙ୍କର କ୍ୟାଲୋରି ରିକ୍ୱାରମେଣ୍ଟ କୁ ଫୁଲଫିଲ୍ କରିପାରିବା ଓକେ protein intake should be also high to prevent body tissues breakdown due to infection and body रे antibodies रो amount कमिबा द्वारा आम body रे ठीक भाबरे टिश्यू गुडिको ब्रेकडाउन हे जाय से बॉडी टिश्यू को ब्रेकडाउन करबा पई हमको प्रोटीन रिच फूड दबा को पड़े what are the protein rich food milk eggs provide protein in bland easily digestible and palatable form they may give a soup like custard protein rich custard it means meat soup egg soup we can provide a liberal intake of carbohydrate will provide energy in easily tolerated form and has protein sparing action ଆଉ ବେଳେ ବେଳେ ଆମର କଣ ହୁଏ protein sparing action କେମିତି ହେଇଥାଏ ନା when we ଆମେ ଯୋଉ ଖାଦ୍ୟ ଗୁଡ଼ିକ ଖାଇଛେ ସେ ସଫିସିଏଣ୍ଟ ଏମାଉଣ୍ଟରେ ଆମକୁ କ'ଣ ହୁଏ ନା ଏନର୍ଜି ପ୍ରୋଭାଇଡ କରିପାରେ ନାହିଁ। In that period ଯେତେବେଳେ ସିରିଏଲ୍ସ ଆଣ୍ଡ କାର୍ବୋହାଇଡ୍ରେଟ ଆମକୁ ଠିକ ଭାବରେ ଏନର୍ଜି ପ୍ରୋଭାଇଡ କରିପାରେ ନାହିଁ, ସେତେବେଳେ ପ୍ରୋଟିନର ମେନ୍ ଫଙ୍କସନ ହେଲା they can act as a protein sparing action. Protein also provide us also 1 gram protein provide us 4 calorie energy. Whereas carbohydrate 1 gram carbohydrate also provide us 4 calorie energy. ଯେତେବେଳେ ଆମକୁ କାର୍ବୋହାଇଡ୍ରେଟ ଠିକ ଏମାଉଣ୍ଟରେ ଏନର୍ଜି ପ୍ରୋଭାଇଡ କରିପାରେ ନାହିଁ, ସେତେବେଳେ ପ୍ରୋଟିନ ତାର ଯୋଉ ଫଙ୍କସନ ରହିଲା ବଡି ବିଲ୍ଡିଂ और बॉडी टिश्यू फॉर्मेशन ब्लड सेल फॉर्मेशन तार जो मेन फंक्शन रहिला से तार मेन फंक्शन को बंद करिकी से कौन करे हमको एनर्जी प्रोवाइड करे. दिस एक्शन इज नोन एज प्रोटीन स्पेयरिंग एक्शन. ସେଥିପାଇଁ ଆମକୁ ହାଇ ଆମାଉଣ୍ଟର ପ୍ରୋଟିନ୍ ଇନଟେକ୍ ଦବାକୁ ପଡେ ଡେଲି ଡାଏଟରେ ଇନ୍ ପେସେଣ୍ଟ ମାନଙ୍କୁ. ଓକେ. Next, fat can be also introduced in the form of cream, butter, oil added to soup and porridge, making a valuable contribution to the energy requirement. फैट को आमे जदि अत्यधिक अमाउंट रे फैट आमे डाइजेशन रे प्रॉब्लम देखिबो सेति पय आमे ऐड करूने, बट वी कैन ऐड फैट to provide us energy requirement fulfill करिबारे हमकु सेटा energy provide करिबारे जेहेतु fat help करता है. And one most important thing is 1 gram fat gives us 9 calorie energy, whereas carbohydrate and protein 1 gram carbohydrate and 1 gram protein gives us 4 calorie energy ଯେତେବେଳେ ଆମକୁ provide କରିଥାଏ. In that time 1 gram fat gives us 9 calorie energy to our body. Okay, so we also add fat in diet therapy or a diet. A fluid intake of at least 2500 to 300 ml daily should be provided to facilitate excretion of wastes and prevent dehydration. 2500 to 300 ml fluid. It may be water, it may be soup, it may be juice, different kinds of fluid or liquid we can add daily basis to prevent dehydration. Okay. What is diarrhea? What is diarrhea? Diarrhea is the passage of frequent liquid stools. The passage of foods through the intestine is abnormally rapid and impairs complete digestion and absorption. Okay. There are many causes of diarrhea, so many causes of diarrhea during the infection in children, infection କାରଣରୁ ମଧ୍ୟ ହୋଇଥାଏ, adults ମାନଙ୍କର infection ମଧ୍ୟ ହୋଇଥାଏ, ସେଇ କାରଣରୁ ମଧ୍ୟ diarrhea ହୋଇଥାଏ. Then overeating, eating wrong foods, eating outside, and incomplete digestion may cause also diarrhea. And this period, during diarrhea period, a people or the person may face stress, strain or excitement. Children and adults may have faced so many problems like psychological problem or mental problem. Even sometimes fear. Fear may also main causes for diarrhea. Sometimes food poison is common culprit for diarrhea. And diarrhea may accompany certain diseases such as tuberculosis, amoebic dysentery, and typhoid fever. During this period, diarrhea also occur because these are the diarrhea is the symptoms for tuberculosis, anemic dysentery, typhoid fever. Okay. And it also a very dangerous for young children because dehydration ହେଇଯାଏ in that period, who may face poorly nourished. Sometimes infection of children is essentially due to poor environmental hygiene and poor sanitation, with special reference to the families of lower income groups in rural area and urban slums. Diarrhea is most common in rural areas, unhygienic environment, and also urban slum. Okay. And also sometimes a poorly nourished child become a victim of diarrhea so many often. So diarrhea causes malnutrition by preventing food from being digested and absorbed properly. Diarrhea को हमें first prevent करिपरिबा by food. What is dehydration? When a child gets diarrhea, his body loss water, so many water. When a child has loss of water during the long period, we say that he is dehydrated due to diarrhea. Diarrhea period रे ସେମାନେ बहुत सारा water loss हुए. Okay. In that period, we also said that they dehydrated. Okay. If this dehydration even happens so many period, or so many hours, child may be die. Okay. And the dehydration develops more quickly and is most dangerous in small children. Dehydration is most important only for not children. It also dangerous for adolescents also and old age person also. What are the sign or symptoms of dehydration? First, little or no urine for symptoms. Second, dry mouth and sunken eyes, loss of elasticity of the skin. Very severe dehydration may occur rapid and weak pulse, first deep breathing, fever, headache. Okay. How can we prevent the dehydration or how can we treat dehydration? ଆମେ କେମିତି treat କରିପାରିବା? While treating diarrhea patient, first of all, medication is not needed for most cases of diarrhea. Medication, no need. Dehydration is the biggest danger in diarrhea. So when the diarrhea lasts for a long time, it leads to malnutrition. We provide enough liquid and good food and at the for the patient. And also we can prevent fast due to dehydration, fast ORS solution, oral dehydration solution. This dehydration ର main ଔଷଧ କହିବାକୁ ଗଲେ ଆମର ORS. It is also known as the ORS is also known as the life-saving devices for dehydration patient or diarrhea patient. Okay. How we prepare oral rehydration solution in home? କେମିତି ଆମେ prepare କରିବା ORS ଟାକୁ ଘରେ? First, we can get a cup of water, normal water. It may be 200 ml or 250 ml. Then we add 1 pinch of salt and we add 4 pinch of sugar and mix them together. After giving ORS, we can give medicine to prescribed by the doctor. When a adolescent person or adult person gets diarrhea in the acute stage, we can be prescribed them to liquid diet like glucose water first of all, then coconut water, blend coconut water. Then gradually we increases full fluid like orange juice, mixed fruit juice. After that we provide sub diet khichdi, all masked vegetables we also provide and also seasonal food also provide some porridge, sagu, we also milk which is fatless or skimmed milk we can provide. What are the infectious disease and how the infectious disease spread from one person to another person? How? Those
एयर द्वारा
disease,
एयर
air, air is a medium of spreading microorganisms. Okay. Another. Those diseases are generally caused by germs, microorganisms, bacteria, and viruses, which we cannot see with our eyes. ଯାହାକୁ ଆମେ ଖାଲି ଆଖିରେ ଦେଖିପାରିବା ନାହିଁ। ବ୍ୟାକ୍ଟେରିଆ, ଭାଇରସେସ୍, ଜର୍ମ ଦ୍ୱାରା ଯେଉଁ ଡିଜିଜ୍ ଗୁଡ଼ିକ ହେଇଥାଏ ତାକୁ ଆମେ କଣ କହିବା? ଇନଫେକ୍ସିୟସ୍ ଡିଜିଜ୍. Viruses are also very smaller than the bacteria. Fungi can also infections cause infections. This also occur in infectious disease. Fungi occur କରିପାରିବ. And which medium we can spread one person to another by touching through air, water, food, contact with dirty clothing, insects, animal bites, darts, dirty fingers, contact with dirty things, infected blood transfusion, unsterilized syringes and needles. These are the medium of spread the infectious disease from one person to another person. Then bacteria. Bacteria can occur. Bacteria are main cause for which disease? Which disease? Bacteria. Bacteria can cause for tuberculosis, TB, tetanus, some diarrhea, pneumonia, syphilis. These are the diseases causes by bacteria. Viruses. Viruses. Disease name is cold, flu, mumps, chickenpox, some of diarrheas, rabies, and AIDS spread through one person to another person by viruses. Okay. Then fungi. Fungi causes ringworm, athlete's foot, some type of itching also. What are the non-infectious diseases? Non-infectious diseases do not spread from one person to another person. And also we cannot catch out the non-infectious disease. Okay. What are the example of non-infectious disease? Example of non-infection disease are heart attack, stroke, epileptic fits, migraine, cataract, cancer. Okay. These are the problems caused by something that we wears out or goes wrong within the body. ଆମ ବଡିରେ ସେଟା ଭୁଲ ଆକାରରେ ଯୋଉଟା ଚାଲିଥାଏ କୌଣସି ପ୍ରକାର ଭୁଲ ପାଇଁ ସେଟା ଅକର ହେଇଥାଏ. The problems caused by something from outside that harms or troubles the body. These are allergy, एटा एलर्जी गुडाक भी नॉन इन्फेक्शियस डिजीजेस allergy asthma is due to the dust, okay, poisoning, snake bite, smoker cough, stomach ulcer, alcoholism. These are the non infectious diseases, and some problems also caused by lack of something the body needs, which are known as nutritional deficiency disorder. Pellagra, such as protein energy malnutrition, anemia, goiter. Goiter occur in which nutrients deficiency? Who can say that? Iodine deficiency disease, goiter. Iron deficiency, anemia. Protein energy malnutrition causes for energy requirement, calories, and protein deficiency of energy and protein. Problems people are born with. These are the well eyes, other deformities, epilepsy, some kinds of epilepsy, retardation, backward in mental abilities. These are problems that are related to mind is nervous or worry, which is known occur after anxiety. Uncontrolled fear is known as phobia. Fear that something is harmful when it is not. Paranoia. These are the non-infectious disease. What, what do you know about the parasites? Which are parasites disease? Or how do parasites are harm us? Parasites are a class of animals which are harmful to the body. They may be internal parasite or external parasites. Internal parasites are live in the body. External parasites are live on the body. So some medium by some body parts from medium. Many external parasites are suck blood, for example, fleas, bedbugs. These parasites are infected with disease or organisms. The malaria parasite passes from one person to another through mosquito bite. These are the parasite disease. How can we prevent the spread of infectious disease? How can we prevent the spread of infectious disease? First of all, we immunize infants and children against common infectious disease of childhood. ଛୋଟବେଳେ ଟିବି ପାଇଁ ଚିକେନ ପକ୍ସ ପାଇଁ ସମସ୍ତଙ୍କୁ ଛୋଟବେଳେ ଇମ୍ୟୁନାଇଜେସନ ଦିଆଯାଇଥାଏ ବା ଇମ୍ୟୁନାଇଜ କରାଯାଇଥାଏ ନ ହେବା ପାଇଁ first of all we prevent this type. Second, if a person has an infectious disease, do not let many people come in contact with him or her. Keep clothing, bed clothes, utensil, etc. Separate them. The infectious disease, which person have infectious disease. Clean hands every time the person is touched. Use proper toilets Don't leave garbage exposed. Which how can we prevent this infectious disease? Use Keep domestic animals outside the house. Sometimes domestic animals are bite, and after that, so many disease also occur. So many people ଯୋଉମାନେ pets ରଖୁଛନ୍ତି ସେମାନଙ୍କର basically ଏ problem ଟା ହେଇଥାଏ. Observe rules of personal hygiene. For example, washing hands after bowel movement, washing hands before every meal. Teach young children to observe this type of rules to prevent infectious disease. I have a question. Can lifestyle or personal factors cause diseases? Yes or no?
Yes.
Yes. If a person who is sedentary, those person have sedentary, does not much exercise, keeps eating all the time. For example, bank manager and other software officers, they don't do much exercise, sitting always every time 24 hours they sit or sleep, and these are also known as sedentary working person. Okay, they develops heart disease and diabetes more easily and early. ସେମାନେ ବହୁତ ये भी ଗୋଟେ ଏକ୍ସପିରିଏନ୍ସ ରୁ ଜଣା ପଡିଛି ଯୋଉମାନେ ସେଡେଣ୍ଟାରୀ ୱାର୍କର ରହିଲେ ଖୁବ କମ ସମୟ କାମ କରିଥାନ୍ତି ବେସିକାଲି ସେମାନେ ମେଣ୍ଟାଲ ୱାର୍କ କରିଥାନ୍ତି ଗୋଟିଏ ଜାଗାରେ ସେମିତି ବସିଥାନ୍ତି କୋଉଠି ସେମାନେ ନା ଏକ୍ସରସାଇଜ କରନ୍ତି ନା ଚଲାବୁଲା କରନ୍ତି ପର ଡେ ରେ ସେମାନେ ବହୁତ ଫେସ୍ କରନ୍ତି ସେମାନଙ୍କୁ ଆମେ ବେସିକାଲି ସେଡେଣ୍ଟାରୀ ୱାର୍କର ବୋଲି କହିଥାନ୍ତୁ ସେମାନେ ବେସିକାଲି ହାର୍ଟ ଡିଜିଜ୍ and diabetes ରେ more easily and yeah, very early they face this type of disease. Okay. How can we prevent damage of the eyes? How? Vartaman basically all his group, including children, adolescent, adult, old age, ସମସ୍ତେ ବର୍ତ୍ତମାନ ଫୋନକୁ ଧରିକି ଦିନ ରାତି 24 ଘଣ୍ଟା 24 ଆୱାର ଧରିଲେ which can affect very easily or damage to our eye. How we measure prevent to our damage to the eyes? And also so many infections also occur. ବାହାରକୁ ଯାଇଥିବେ କି ଜଣେ during drive ବାଇକ୍ ଡ୍ରାଇଭ୍ ଯୋଉମାନେ କରନ୍ତି ସେମାନେ ବହୁତ ସାରା ଇନଫେକ୍ସନ ଯୋଉଗୁଡା ପୋକ ଗୁଡା ଆସି ବାଜି ଯାଆନ୍ତି ବହୁତ ସାରା ଇନଫେକ୍ସନ ହେଇଥାଏ in that case first apply antibiotic ointment for the eye infection by prescribing by the doctor. Do not let a person with an eye infection come in contact with others. ସେମାନଙ୍କୁ ଅଦରଙ୍କ କଣ୍ଟାକ୍ଟରେ ଜମା ବି ଆଣିବାକୁ ଦିଆଯିବା କଥା ନୁହଁ। ଏବଂ ସେ ଜାଗାରେ ସେମ୍ ଜାଗାରେ ବା ଯୋଉ ଜାଗାରେ ଆଇ ଇନଫେକ୍ସନ ହେଇଥାଏ କୌଣସି ପ୍ରକାରର ସେ କ୍ଲଥେସ୍ ହେଲା, ହ୍ୟାଣ୍ଡସ୍ ହେଲା, ହ୍ୟାଣ୍ଡକରଚିପ୍ ହେଲା, କୌଣସି ଜିନିଷ ଲଗେଇବା କଥା ନୁହଁ। And at that time or during eye infection period or damaging period of eye, they eat plenty of dark green vegetables because dark green vegetables are rich in vitamin A, and yellow or orange fruits and vegetables to get enough vitamin A to the protect these damage. And vitamins A also known as protective nutrient, and also another word also known as anti-infective vitamin A. Always vitamin A's other's name is anti-infective vitamin because it prevent any type of infection to our body. How we keep teeth and gum healthy? ଆମେ କିପରି ଆମର teeth ଆଉ gum କୁ healthy ରଖିପାରିବା? It is important you remember that rotten teeth can lead a serious infection that may affect other parts also of our body. So we take care of the teeth. How we take care of our teeth and gum? How? First point, avoid eating too many sweets and consuming too many soft drinks. Avoid. Second, brush. Basically teeth prevention ଟା ବା teeth କୁ healthy ରଖିବା portion ଏଟା ଛୋଟ ପିଲାମାନଙ୍କ ପାଇଁ ବା children's ମାନଙ୍କ ପାଇଁ. Okay? Brush teeth very well every day in the morning and in the night. See dental doctor immediately. And use antibiotic and pain reliever if tooth infection is severe. Protect the gums by removing food that sticks between the teeth. Eat protective food which are rich in rich in minerals and vitamins. Because calcium is the mineral, phosphorus is the mineral which protect our teeth. How can we identify a person who is suffering tuberculosis? How? ଆମେ କେମିତି ତାକୁ ଆଇଡେଣ୍ଟିଫାଏ କରିବା ଯେ ଜଣେ person TB ବା tuberculosis disease face କରିଛି? First, a person TB usually has chronic cough, especially just after waking up, mild fever in the afternoon and sweating at the night, pain in chest and upper back, chronic loss of weight and increasing weakness. These are the symptoms of tuberculosis. Can we prevent the tetanus disease? Yes, we can prevent the tetanus disease. How? Very easily. Vaccinate TT Miluchi. Okay, we get tetanus. Antitoxin is important when any infection or any injury occur in your body. What are the simple steps for avoiding malaria? What are the simple steps? First of all, don't let mosquito breed around your house or in your locality. Clear all stagnant water, drain or put a little oils on pools and marshes. Do not leave any container or broken pots which can collect water. Cooperate with malaria control workers in your area. Don't let mosquitoes bite your family members. Cover yourself through mosquito net. Take a regular dose of chloroquine tablet. Then we can avoid malaria. What are the steps to prevent the typhoid? First, avoid contamination of water and food by human feces. Construct and use latrines, and those latrines must not to be close to the drinking water supply. Boil drinking water, particularly if there is a likelihood of typhoid appearing in the area. A typhoid patient should remain in a separate room. His dishes, clothes should be separate, and those person who care for him should wash their hands frequently, particularly after handling the patients or items used by the patient. What are the general guidelines for cleanliness in the home? Do not let any domestic animals into the house or places where children play. If children or animals have bowel movement near the house, clean it up at once. Teach them to use latrines. Use appropriate medicine or other means to remove infection by lice or fleas. Don't split on the floor because spit can spread diseases. When you cough, sneeze, cover your mouth with your hand or cloth or handkerchief. How we deal with fever in small children? How? Because we know that in small children, high fever can be dangerous. Small children ମାନଙ୍କ ପାଇଁ high fever ବହୁତ dangerous. It can cause fits or damage the brain. To lower fever quickly, remove all the clothes of the sick child, soak with the cloth pads soaked in cool water and fan the child. Also give aspirin in the right amounts. Okay. Give plenty fluids, extremely important because dehydration can kill a small child very shortly or early. ମୁଁ ଏଟା କହିଛି dehydration ଛୋଟ ଛୁଆ ମାନଙ୍କ ପାଖରେ ହେବ ମାନେ it may be occurs to die. Okay. What is the best way to prevent hookworm or infections? Hookworm larva, if hookworm or larva enters the body by piercing the skin of the feet, it is important not to walk barefoot. Okay. Common infectious disease like chickenpox, measles, mumps, whooping cough. How we to reduce this common disease? During the chickenpox, first bath the child daily with soap and warm water. Apply a cool cloth soaked in water. Cut fingernails short. Use antibiotic ointment for scabs. Keep the child under bed rest. Give plenty of fluids and nutritious food. If the baby cannot breastfeed, give breast milk in a spoon. ଛୋଟ ଛୁଆ ମାନଙ୍କ ପାଖରେ breast milk is the most powerful ଆଉ ଯୋଉଟା କି prevent କରେ different types of infection को. Okay. Then mumps disease को केमती आमे reduce करि परिबा. Bring down fever and relieve pain using aspirin. Give the child soft and nutritious food. Keep the child's mouth clean. Whooping cough. Get medical help in the early stage. Treat using by prescribed by the doctor. Treat antibiotic. Okay. Give nutritious food soon after the child vomits and avoid weight loss and malnutrition. Then diphtheria. Keep child under bed rest first. Keep separate from other persons. Get medical help quickly. There is a special antitoxin for diphtheria which is prescribed by the doctor. give antibiotic therapy, have the child gargle warm water with a little salt, that is home treatment. Try and remove the membrane from the throat of the child using cloth wrapped around the finger if the child begins to choke and turn blue. Polio, how to prevent this? Use aspirin in suitable doses to reduce pain. Use warm water soaks to relieve pains in muscle affected by the disease because in this period muscles affected. Once polio starts, nothing can be prevent paralyzed. So first precursor ଅବସ୍ଥାରେ ଆମକୁ ଏସବୁ ଗୁଡ଼ିକୁ ପ୍ରିଭେଣ୍ଟ କରିବାକୁ ପଡ଼ିଥାଏ. Okay. Anyone have any doubt? Can you ask? Any doubt?
No, ma'am.
No doubt. Okay. Can take next class tomorrow.